My name is Hcg Samuel. I'm the fertility scientist at Abim's Fertility and Garment Banking Services, number 37, Akinremi Street, Anifose, Ikeja, Lagos. I want to discuss why IVF fails. I mean, people go for ART procedure called IVF and it will fail. Number one, we are talking about poor egg quality. That is why every woman who wants to do IVF should do what we call anti-Mullerian hormone. This will let you know that whether your egg quality is good or not. There are some drugs there are some medication you could take that will improve the quality of your egg before you submit yourself for IVF. Number two, poor sperm quality. I've said it so many times that a man has a good sperm count does not mean the man is fertile. Rather, the sperm count, the sperm that is very many must very good. What makes sperm to be good is the genetic content of the sperm cells. There's something we call sperm DNA. Many men have damaged their sperm DNA by taking alcohol, some chemical they inhale, some toxin in the system, in the environment, and tobacco, cigarette. These are those things that make the sperm DNA to be damaged. And when you are doing semen analysis, unless you do sperm DNA fragmentation test, you won't know. So some of the sperm that they claim that they are very good, some of them have a damaged DNA. That is why by the time they do use them for IVF, the quality of embryo they will bring out will be very poor. Third one is stimulation protocols. And the protocols that the embryologists use in stimulating patients supposed to be a personalized one with the patient, because under stimulation will not bring out the follicle needed, and if you hyperstimulate, at the end of the day you won't get a good follicle. That is why the stimulation protocols must be very unique with the patient fertility status. Another one is Hcg injection. The timing of Hcg must be very precise. When the Hcg injection is not given at the right timing, it may make IVF fail. The fifth one is endometrium. Endometrium must be receptive enough before it could accept the embryo and implantation will take place. If the endometrium is not receptive, then after the embryo transfer, the womb will not support pregnancy. That is why it is necessary for a woman to run hormonal tests, check their LH, their FSH. IVF is not something that you need to rush into. Some of you need to be examined very well, place some medication so that your hormone is balanced before you go in for IVF. The thinking that you do not need to do anything because they are just bringing a complete baby into you will not be okay. It is not ideal. You need to run hormonal tests, check and make sure that your hormones is balanced, and that is when all your body is ready for the procedure. The sixth one is embryo transfer. If the embryo transfer is traumatic, it may affect the success of IVF. Last one is the IVF laboratory must have all the required equipment. The personnel that is working must have the right skill and must be competent. IVF is not the final solution to infertility. You need to know that there is no 100% fertility treatment anywhere in the whole world. If you are going in for IVF, the man and the wife need to check themselves very well. If your result is not good, please, you can treat yourself. Man need to take a lot of antioxidants so that the quality of semen they will be producing will be improved. My name is Hcg Injection. I'm the fertility scientist at Sperm Fertility and Garment Banking Services. Number 37, Akinremi Street, Anifoshe, Ikeja, Lagos. What do we do in IVF? We investigate both male and female infertility. Till I come your way next time, I tell you, God is with you. When He promised that He will do it, He will do it. But you need to take your step. Do not be discouraged. Do not be downcasted. Do not be discouraged. Do not fed up. Your baby is near. Bye.